Welcome to this deep dive, designed just for you guys.
Yeah.
Today, we are going to be tackling a pretty critical pressure point in healthcare,
Oh.
the constantly changing world of oncology care.
Okay.
So you shared with me some really compelling material highlighting the challenges for everyone delivering cancer treatment.
Right.
And we're going to try to really get into how they're navigating this really intense landscape. It really makes you think about all the stuff that's going on behind the scenes,
Yeah.
to keep everything running smoothly.
Well, what's striking when you look at the sources you sent
Yeah.
is just the huge impact cancer has. I mean,
Yeah.
the fact that almost 1 in 2 people will face it at some point in their lives
Wow.
creates this almost unimaginable demand for oncology services.
Yeah.
So we should really focus today on how healthcare providers, especially oncologists, adapt to this huge need and still manage to provide really excellent care.
Absolutely. And we
Yeah.
should also point out, it's not just about the medical treatments themselves, right? We're going to get into the surprisingly significant role that admin tasks play in oncology
Okay.
and how outsourcing some of those key functions could actually make a huge difference in the experience for both the healthcare professionals and, of course, the patients.
Right.
Think of it this way.
Uh-huh.
We are going to be looking at the engine room of cancer care.
Yeah.
The machinery that you don't always see that either drives things forward or, creates roadblocks and frustrations.
That's a great way to put it.
Yeah.
And your sources definitely make it clear that cancer care,
Yeah.
it's much more complicated than just giving chemo, radiation, or surgery.
Right.
It really needs a very coordinated effort
Uh-huh.
from a whole bunch of specialists.
And this is where the burden of administrative work really becomes apparent.
Yeah.
One of the things that really stood out to me in the material was that stat
Uh-huh.
that oncologists can spend almost half of their day just doing things like processing insurance claims,
Oh.
going through those never-ending prior authorizations,
Right.
verifying coverage and dealing with all the billing stuff.
Yeah,
It's kind of wild.
it is.
If our cancer specialists are using that much time on admin,
Yeah,
what kind of knock-on effects have you seen on patient care?
that's a really good question.
Yeah.
I mean, when you've got these incredibly skilled medical professionals and they are spending so much time on admin tasks,
Yeah.
it just pulls them away from actually interacting with patients.
Right.
Which means less time for those really in-depth consultations, less time to go over and really personalize this complex treatment plans,
Right.
and frankly, less time to just be present and supportive
Yeah.
for patients during what's got to be an incredibly vulnerable time.
Yes.
You're basically diverting this crucial expertise.
It really does almost feel like a paradox.
It does.
The very experts we need focused on, all those nuances of treatment
Right.
are instead stuck dealing with paperwork.
Exactly.
And your sources also talked about burnout
Yeah.
among oncology teams. How does that constant admin pressure contribute to that?
It's kind of a snowball effect. You've got the emotional and intellectual demands of these complex medical cases. And then on top of that,
Yeah.
you add the frustration and the sheer amount of time that admin takes up.
Yeah.
It just creates this huge amount of stress.
Yeah.
And that can lead to burnout,
Right.
which obviously affects the well-being of the providers themselves.
Uh,
But it can also indirectly affect the quality of care for the patients if the whole team's stretched thin and just exhausted.
right.
You have to wonder how sustainable this model is.
Yeah. And it makes you realize that the tools that are mentioned in your sources, they're not just talking about the newest medical advancements.
Right.
It's really about needing systems that can effectively handle things like verifying insurance, ensuring treatment is actually covered,
Yeah.
and making the billing process way more efficient.
Absolutely.
That really sets the stage for us to understand why outsourcing some of these functions could be so valuable.
Totally.
Like, it could really change the game.
Yeah.
And that actually leads us to one of the biggest pain points that's mentioned, prior authorization in oncology.
Right.
Your sources really highlight that as being especially critical and, kind of agonizing.
It is.
Why has this become such a massive bottleneck?
Yeah.
Especially when we're talking about these potentially life-saving treatments.
Yeah.
Like all those new chemo drugs, targeted therapies, and immunotherapies.
Yeah.
What's the root of the problem here?
It's interesting. And honestly, it's often pretty frustrating.
Huh.
There's this tension between insurance companies wanting to manage costs,
Yeah.
which is understandable,
Sure.
and making sure treatments are being used correctly.
Right.
But at the same time, patients need access to these potentially life-changing treatments.
Right.
And they need it without delays.
Right.
And because these new oncology therapies are so expensive,
Yeah.
they often require pre-approval.
Can you walk us through what that prior authorization process actually looks like
Sure.
for an oncology team, and what do they actually have to do?
Well, typically it involves a ton of paperwork.
Mm-hmm.
The oncology team has to gather all this documentation
Yeah.
with the patient's diagnosis,
Okay.
the treatment plan, including exactly which drugs and how much,
Wow.
and the medical reasons why they chose that particular therapy.
Oh.
So they have to pull together clinical notes, imaging reports, lab results.
It's a lot.
Yeah.
And then I imagine there's a ton of follow-up calls with the insurance company
Yep.
to clarify stuff
Yeah.
and answer questions
Exactly.
and basically fight for the patient to get approval.
It's like going through a maze.
Ugh. I can only imagine.
Yeah.
I think anyone who's ever had to deal with an insurance company can relate to those phone calls.
Right.
So much time wasted, so much frustration.
Mm-hmm.
What are the actual consequences then for patients when these authorizations get delayed or even denied?
Well, if you think about the bigger picture of a patient's journey with cancer,
Yeah.
delays in getting authorization can lead to setbacks.
Mm-hmm.
Treatment might have to be postponed,
Right.
and that could allow the cancer to progress
Oh, wow.
or become harder to treat.
That's scary.
And denials are even worse,
Yeah.
because then you often have to go through a really long and stressful appeals process,
Oh, gosh.
which delays access to care even more. It's an added layer of anxiety and uncertainty.
That's terrible.
Yeah, and it's completely unnecessary.
And your sources also point out the burden this puts on healthcare providers
Right.
all the time, that oncologists and their teams spend battling for these authorizations.
Yeah.
It's not just the admin staff, it's the specialists too.
Exactly.
Yeah.
Oncologists and their teams are spending so much time
Yeah.
that they could be using to actually care for patients
Right.
or do research
Sure.
or collaborate on treatment plans.
Yeah.
They are using it to manage this bureaucratic process.
It's a mess.
It is.
And that admin overload contributes to the burnout we were talking about.
Absolutely.
And that's where outsourcing this specific task,
Uh-huh.
prior authorization,
Yep.
could really help
It could.
take some of the pressure off.
Right.
Let them focus on their expertise.
Exactly.
It makes so much sense.
It does.
Offload that complicated and time-sensitive task to people who really know how to navigate it all.
Right.
Now, there's another crucial area that your sources highlight, insurance verification
Okay.
and the broader world of revenue cycle management, or RCM.
Yeah.
That sounds like another layer of complexity
Is.
for oncology practices.
It-
What's involved there?
Well, oncologists and their practices have to be able to accurately confirm patient insurance coverage,
Uh-huh.
especially when you consider the massive costs associated with these new cancer treatments.
Yeah,
It's a real challenge.
I can imagine.
I mean, there are so many different insurance plans,
Right.
each with its own set of rules,
Yeah.
lists of which drugs they cover,
Yeah.
and various limitations.
Ugh, it's just this constantly changing landscape.
Yeah.
So why is it so important to get that insurance information right from the start?
Well, because
Yeah.
if you don't, you run into billing errors and claim denials.
Okay.
And that leads to lost revenue for the practice,
Right.
which impacts their ability to give good care.
Uh,
And it can mean patients end up with huge unexpected bills,
yeah.
which just adds to the stress they're already under.
So how can outsourcing this initial verification process
Yeah.
actually help both providers and patients?
Well, if you outsource that verification to a specialized team who
Yeah.
really know what they're doing
Yeah.
and use the right tools,
Okay.
you can speed up the process,
Huh.
reduce errors,
Yeah.
and make sure patients can get the care they need
Right.
without having to worry about financial roadblocks later on.
That makes sense.
Right.
So it sounds like that could provide a lot of relief and security for everyone.
I think so.
Okay. So now let's dive into revenue cycle management.
Okay.
Can you break down what that means?
Yeah.
Especially in the context of an oncology practice.
Yeah.
What are all the pieces involved?
So RCM in oncology is basically the whole financial process
Uh-huh.
from the moment a patient makes their first appointment
Okay.
all the way to when the practice gets paid.
Got it.
So that includes things like accurate medical coding,
Mhm.
which is super important for those complex oncology treatments.
Yeah.
It also includes preparing and submitting claims to insurance companies,
Okay.
following up on those claims,
Right.
and dealing with any denials or appeals.
It sounds really complicated.
It can be.
And I bet with all the different treatment types and combinations of therapies
Yeah.
and multiple specialists involved.
Mm-hmm.
That coding and billing can get super complex and prone to errors. You are absolutely right.
Oncology coding is its own special thing,
Yeah.
and it changes all the time.
Uh,
Even small coding errors can cause big problems
wow.
with getting paid.
Yeah.
And because treatment plans are often really long
Right.
and involve so many different providers and procedures,
Uh-huh.
everything has to be documented and billed perfectly.
It's a lot.
It is.
So if claims aren't prepared right the first time,
Yeah.
or if there isn't good follow-up,
Mm-hmm.
practices can lose a lot of money,
Right.
which can make it hard to keep providing care.
So in this really complex environment,
Yeah.
how can outsourcing the whole RCM process help?
Well, when you outsource RCM to experts who specialize in oncology billing,
Uh-huh.
you get a lot of benefits.
Okay.
They know how to make sure claims are coded correctly
Right.
and submitted right the first time,
Uh-huh.
which reduces errors and denials.
Got it.
They also handle all that follow-up,
Okay.
spot any potential problems,
Yeah.
and manage any appeals that need to be done. Wow. So it streamlines the whole revenue collection process.
Yes, Clay.
And that helps the practice stay financially healthy.
That's right.
It's really interesting.
It is.
It's like you're making sure the financial engine of the practice runs smoothly
Yeah,
so the clinical teams can concentrate on patient care.
absolutely.
Now, your sources also talk about appointment scheduling,
Mm-hmm.
which obviously impacts the patient experience directly.
Right.
It might seem pretty straightforward at first,
Yeah.
but I can imagine in a busy oncology practice,
Uh-huh.
it gets pretty hectic.
It does.
What are some of the challenges?
Well, oncology practices often have really high demand for appointments,
Yeah.
and that demand can change a lot.
Okay.
You've got initial consultations, which
Right.
are often urgent, ongoing treatment schedules that need to be perfectly coordinated,
Wow.
important follow-ups to check progress,
Right.
and then coordinating care with all sorts of other
It
specialists.
sounds like a logistical nightmare.
It can be.
So in that environment, efficient scheduling becomes super important.
Absolutely.
What are some of the problems that come up when practices try to handle all this in-house?
If you don't have good systems and dedicated staff,
Uh-huh.
you can end up with missed appointments,
Yeah.
which messes up treatment schedules,
Right.
and then scheduling conflicts,
Right.
which can cause delays
Right.
and long wait times, which is not good when patients are often already really anxious.
What's not?
All of that can lead to frustration,
Sure.
delays in treatment,
Yeah.
and a bad experience for patients.
So how can outsourcing help with that?
Well, if you outsource to teams who specialize in this
Yeah.
and use advanced scheduling technology,
Okay.
it can really optimize things.
Oh, yeah?
You can reduce those missed appointments
Uh-huh.
because you've got proactive reminders and efficient ways to reschedule.
Uh.
You can make sure appointment slots are used well
Right.
so patients get seen quickly. And it creates a more streamlined and patient-centered experience.
So it makes things less stressful
Exactly.
and helps patients get the care they need.
Absolutely.
So we've talked about all these different challenges.
Yeah.
Prior authorization, insurance verification, RCM, and scheduling.
Right.
How does outsourcing all of these things
Mhm.
actually give oncology providers that much-needed relief?
Well, when you think about all these things together,
Mhm.
the main benefit is that it frees up so much time and energy for the oncology teams.
Okay.
Instead of being buried in paperwork and on the phone with insurance companies
Yeah.
and trying to figure out complex billing,
Right.
they can actually focus on what matters most,
Yeah.
which is caring for their patients.
Absolutely.
And your sources lay out some pretty clear benefits.
Okay, let's revisit those.
Sure.
What are the key advantages that outsourcing can bring?
So first of all, it
Mhm.
takes away a lot of that admin burden.
Right.
So oncologists and their teams can get back to focusing on patient care. Second,
Mhm.
it improves accuracy in insurance verification and RCM.
Right.
So services are covered properly.
Yeah.
And the practice gets paid on time.
Makes sense.
Third, it helps to avoid those treatment delays caused by prior authorization,
Yeah.
which leads to better care and outcomes for patients. And finally, it optimizes scheduling,
Yeah.
so it's easier for patients to get the care they need when they need it.
So it's really about creating a system that is more efficient,
Yep.
more sustainable,
Uh-huh.
and ultimately more patient-centered.
Exactly.
I like it.
Yeah.
So to sum up,
Yeah.
it's pretty obvious that cancer care is about way more than just the medical treatments themselves.
Right.
It's true.
I mean, the admin and logistical challenges that these practices face every day, they have a huge impact on how care is delivered and on the well-being of both the patients and the healthcare providers.
Absolutely.
It's all connected, just like your sources say.
And the possibility of outsourcing those key administrative functions, like prior authorization, insurance verification, and revenue cycle management, it could really help.
It could.
It could make things more streamlined, reduce those administrative burdens, and allow oncology teams to get back to what's most important, supporting their patients through their cancer journey.
That's a good way to put it.
Yeah.
This deep dive has really highlighted how healthcare and operational efficiency are connected.
That's a good point.
And it makes you wonder what other seemingly non-clinical things are really impacting the quality and accessibility of healthcare. And how can we fix those behind-the-scenes problems to get better results for everyone?
That's something we should definitely keep exploring.
I agree.
Yeah.
It's a conversation that needs to keep happening.
It does.
So thanks for joining me for this deep dive.
You're welcome.
And thanks to you all for listening. Yeah, thanks for listening.